Hello friends, welcome to Help, Honeymanian education and learning platform, where we are promoting Honeymanian homeopathy. Our aim is to instill the confidence in every homeopath to give beautiful, wonderful results, not only in simple cases, but also in difficult cases, difficult pathological cases, and also genetic cases like Down syndrome, Turner syndrome, Duchenne muscular dystrophy, sickle cell anemia. Friends, these are various genetic diseases which are seen in our clinics. Not always, but sometimes we see such difficult cases. And when we see such difficult cases, suppose these patients come to your clinic, then the first question arises in your mind is, what is the scope of homeopathy? Yes friends, what is the scope of homeopathy? As a homeopath, we all are master enough, we all are good enough to give results in cough and cold, arthritis, asthma, psoriasis. Yes, but the challenge comes exactly when we talk of genetic diseases. So, is there any scope of homeopathy in genetic diseases? Genetic diseases where allopathy fails, do we have any chance? Can we show our supremacy of homeopathy over allopathy by giving results in genetic diseases? Yes friend, there is a good scope of homeopathy in genetic diseases. Friends, I have understood this difficult concept by after many failures. After many failures, I understood that homeopathy can give beautiful result in genetic diseases also. And I have launched this project called as GenoCare, where we say genetic wellness through homeopathy. Yes friends, we can help patients with genetic diseases also. So in this course, I am going to highlight upon what are genetic diseases, how to approach those genetic diseases, how to manage those genetic diseases. Friends, when I talk to various homeopaths and when I ask this question that there is a case of Down syndrome in front of me, what is the approach? How will you approach this case? Many of us came to this unique and unanimous observation that mother's history during pregnancy is very important. So they say that in all genetic cases, mother's history during pregnancy is important, and that is the most vital point when you approach genetic cases. But friend, is this right? When you talk of mother's history during pregnancy, my question is that why not father's history during pregnancy? Is it not important? Is father not contributing anything to the child? Father's genes are not important? Friends, so this course I am going to highlight on those cases where father's history is more important than the mother's history. And also when we talk of mother's history during pregnancy, it is not just a broad generalized idea of taking the mother's stress during pregnancy, but exactly trying to understand what part of the mother's history, again, what part of the mother's history is important. Whether history during the first trimester is important, second trimester is important, third trimester is important. Friends, when we talk of Down syndrome, do you think that genetic mother's history during pregnancy is important? A thought for you, a challenge for you, and an interesting question for you all. If you feel that mother's history during pregnancy is important for the genetic cases, if you feel that mother's history is important for the Down syndrome cases, friend, this course is for you. In this course, I am going to help you understand what part of mother's history is important. Many of us are prescribing specific remedies. Friends, no matter, any amount of specific remedy is not going to help in genetic cases. Here you have to give the right genetic constitutional similum. Then only you are going to get good results in genetic disease. So specific remedy is not useful. many of my colleagues, they say that we don't take mother's history during pregnancy, we just take the child's totality and prescribe. Again friend, this is not going to help. So the main aspect of management of genetic disease is to first understand what is genetic disease. Aphorism number 3, knowledge of disease is very important, and when you understand what is a genetic disease, what type of genetic disease is this which you are encountering, then your results will improve. Second thing is, mother's history during pregnancy is very important, but that is not the sole criteria. So in this case, in this course, I am going to bust this myth that mother's history during pregnancy is important. Friends, no, mother's remedy is also important. What is different between mother's stress during pregnancy and what is different between mother's remedy, father's remedy, father's stress during pregnancy, and finally what part, whether first trimester, second trimester, third trimester, what is more important, we will be highlighting on all these points. So friend, what happens when you just blindly approach all genetic cases with only one concept of mother's history during pregnancy? Friend, this is what I have seen. This is the whole crux of homeopathy. It is either a hit, sometimes you get the history right, so sometimes you get, but most of the time it is a miss. Friends, this I have found, there is lot of uncertainty in homeopathy on results. Any case which comes to you, sometimes you get good result, sometimes you don't get result. Most of the time you don't get result because that understanding is lacking. There is lot of uncertainty in homeopathy, and my aim with this course is to remove the uncertainty in homeopathy and give good result with certainty. Yes, this is a case in front of me, and I am very confident that I will be able to treat this case. So giving certainty in homeopathy is my approach, is my belief, and this is what I am going to share with you. How to give good results with certainty in homeopathy. If you want to show supremacy of homeopathy over allopathy, if you want to give good result in genetic cases, then this course is for you. This course is not for people who want to give specific remedy or who are just routine prescriber. But if you believe in Hahnemannian principles, if you believe in homeopathy, and if you believe that yes, homeopathy is superior and can give beautiful results in genetic cases also, then this course is for you. It is an eye-opener for all those who have this misconception that just mother's history during pregnancy is very important. I encourage you all to subscribe to our course and understand about genetic diseases in depth. Thank you.